Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. Okay, and welcome back, everyone. You've probably heard about the press release. Justin Trudeau has decided to close borders to within certain details. Of course, Canadian citizens will be allowed back across again. Permanent residents will, of course, be allowed back, and there's some if-thens and things like that go along with this, but for the most part, the border will be closed, and there will be only 4 airports open for international travel. That would be Vancouver, Calgary, Montreal, and in Toronto. All other airports will be shut down away from international travel, so they will not be receiving flights from outside the country. All the rest of the flights will be directed to the airports I just stated. So he's trying to him and his government are trying to put measures in place so that Canadians are kept safe, and trying to get ahead of the curve of the climbing numbers of the virus itself. So the measures that he's putting in place hopefully will do what they're supposed to do. As of right now, total cases across Canada are 324. And when I come back after playing the clip of Justin Trudeau's statement, I will read off the breakdown according to province and territory. So here we go.
Not applied to trade or businesses. We will continue to ensure that Canada can continue to receive important goods.
Starting Wednesday, March 18th, only 4 Canadian airports will be accepting international flights: Toronto Pearson, Montreal Trudeau, Vancouver International Airport, and Calgary International Airport. At this time, domestic flights, as well as flights coming from the U.S., Mexico, the Caribbean, and Saint-Pierre-et-Miquelon, will not be affected. The travel restrictions announced today will not apply to commerce or trade. We will continue to ensure the supply of important goods to Canada. I know that these measures are far-reaching. They are exceptional circumstances calling for exceptional measures. Earlier today, I had a call with our G7 partners to inform them of these important changes. From the very beginning, Canada's response has been based on the latest available science and advice from our world-class health professionals. Today's announcement is no different. These measures will help save lives. From
the outset, it has been important for me that Canadians have access to the recommendations of healthcare professionals and experts. It is their knowledge and their expertise that has been guiding the measures taken by the government, but also by individuals. Access to the latest information, Health Canada will be providing a daily update at the same place.
Its daily update at the same place at noon, starting tomorrow. Today, their press conference will take place after my remarks. The measures
announced today can be added to all that our government has been doing up until now. Last Friday, Minister Morneau announced new measures to financially support workers and employers right across the country.
$10 billion available in additional support for Canadian businesses. This is a tool that has worked before in difficult circumstances, and we're confident that it is going to work again. The economic impact of this pandemic is shifting hourly, and we recognize the stress and anxiety that it is causing. As I've said, we are prepared to see Canadians through this time. We will have additional measures to announce as early as tomorrow to support Canadians, particularly our most vulnerable. Right now, provinces and territories are facing different realities and risks, which means taking steps that make sense for people in each area. At the same time, we also need to keep building an aligned, Canada-wide approach. On Friday, I held a telephone meeting with the Premiers and Deputy Prime Minister Freeland, and information has been flowing continuously since. We've been in constant communication with the provinces and territories so that there are no barriers between our jurisdictions during this critical time. During the meeting, I spoke to premiers about the $1 billion COVID-19 response fund our government has put in place, which includes support for provinces and territories and their healthcare systems so hospitals can prepare. We can still slow the spread of this virus, but as Dr. Tam said, that window is closing. So far, we've seen many provinces take aggressive steps to protect their communities. I want to thank them for as well as the provinces and territories. Minister Van Daal has also been connecting with the territories and is working on exceptional measures to protect the North. We're making sure that everyone, no matter where they live, is prepared. The
measures announced today can be added to the recommendations of public health officials. I want to remind all Canadians that they should avoid non-essential travel outside the country until new information is provided. We also recommend all those who are currently aboard to return to Canada while it is still possible to do so. I want to be clear. If you are abroad at this time, it's time to come back home. If you have just returned, you must self-isolate for 14 days. And finally, all Canadians should stay home. By staying home, we can not only protect your health and the health of your family, but also ensure that our healthcare professionals and our healthcare system can provide more support to those who truly need it.
All Canadians that they should avoid non-essential travel outside of our country until further notice. Canadian travelers should return to Canada via commercial means while it is still possible to do so. Let me be clear. If you're abroad, it's time for you to come home. If you've just arrived, you must self-isolate for 14 days. And finally, all Canadians, as much as possible, should stay home. By staying home, you can not only protect your health and that of those around you, but ensure that our healthcare professionals and our healthcare systems can focus on those who need their help. This is an adjustment for all of us. We know that staying home is an important step to protect the community and each other. We all have to do it. But I want to remind all Canadians that social distancing doesn't mean we have to stop talking to each other. Pick up the phone, write an email, FaceTime. The strength of our country is our capacity to come together and care for each other, especially in times of need. So call your friends. Check in with your family. Think of your community. Buy only what you need at the store. But if you're heading out to grab groceries, ask your neighbor if you can get them anything. And if you know someone who is working on the front lines, send them a thank you. See how they're holding up. In Canada, we're lucky to have outstanding healthcare professionals. I want to thank them once again for their tireless efforts to keep us all safe. At the same time, our government is doing everything it needs to do to keep you safe, to keep your family safe, and to keep our economy strong. No matter what our next steps look like, you can rest assured that we will take them together, with premiers and mayors, with doctors and families and neighbors, because that is what Canadians do in difficult times. We pull together and we look after each other. Merci beaucoup tout le monde.
Radio-Canada, Mr. Trudeau, the response of your government is being said to be too slow by many. Particularly, they're saying that there were lax measures in airports. Are you taking any responsibility for what your government has done? Well, we understand that the situation is evolving very quickly. We have taken significant measures in recent days, and we will continue to do so. As of today, I understand the concern that people have, but I can assure you that the measures are in place to keep people safe.
I will highlight that the situation, as we all know, has been evolving extremely rapidly. We've taken measures over the past number of days to keep Canadians safe, and we're taking more measures, significant measures today. I can understand people's frustration, and that's why we're ensuring that there is more that will be done every step of the way to keep Canadians safe.
So you don't think you've made any mistakes thus far? Well, there are certainly things we have to do, and we will continue to do more every day. Now, with respect to the United States, why not include the United States? So what's part of that equation? We are very closely coordinating our operations with the United States. In recent days, I've spoken several times to President Trump. We recognize the integration of our two countries, and that demands a particular level of coordination over the next steps, and that is what is happening.
Prime Minister, you've been telling us for several weeks now that a travel ban was not required, that it wasn't helpful. What changed your mind overnight, and do you regret not acting sooner to take this step that's taken by other jurisdictions, other countries?
This situation, as everyone knows, has been evolving extremely rapidly, and the recommendations of public health and public safety have been evolving as well. At every step, we've taken the best advice of our public health officials, and now is the time to take this particular step. It is a significant step. It is a step that we take in exceptional circumstances, but it is the right step to be taking today.
Another brutal day on the stock markets this morning. TSX is down 7% just this morning, actually almost 8%. What is your message to Canadians who are seeing their retirement savings being wiped away, and especially those who are thinking of retiring in the near future?
Our focus right now is on ensuring that Canadians who are staying home from work have enough money to be able to buy groceries and pay their rent. These are measures that we will be moving forward with in the coming days to ensure that people can keep themselves and their loved ones safe and healthy. We will, of course, be moving towards supporting businesses, as we already have, with significant access to credit of $10 billion and other measures to ensure that in the short term we are able to continue to support each other. In the medium term and then into the long term, we will need to invest significant amounts to restore people's confidence in the economy, to restore the kind of growth that is going to ensure a better future for all Canadians, and we will do those things as we need.
Just in the same vein, we know that there are announcements coming about help for families, but can you tell the families who need help when they will be able to receive it? Well, we will be making money available to families, the most vulnerable ones, in the coming days. We understand that there are many people out there who are very worried about their ability to feed their family or pay their rent. So these are concrete concerns, particularly among people who do not have employment insurance and hold vulnerable jobs or part-time jobs. And that's why we will be making announcements in the coming days that will show that these people will receive the necessary money to come through this period. When will people get that money? We'll be announcing that in the coming days.
Public health officials say many of the new cases can be traced to the U.S. Why are U.S. citizens exempt from entry restrictions to Canada?
We've been collaborating very closely with the United States, coordinating various measures that we've taken together. The level of integration of our two countries is quite particular, which is why we need to do some more work in order to ensure that we're doing what we need to do in the right way. But our first preoccupation is and always will be the continued safety of Canadians, and we will take the measures necessary to keep Canadians safe.
But then why are U.S. citizens being allowed into Canada? What does this mean for the U.S. border? Is it going to be closed at all? At
this point, we are closing our borders to all non-Canadian or non-permanent residents of Canada. We are recognizing that for the moment that measure does not apply to U.S. citizens, but we will have more work to do in the coming days to ensure that we're doing everything we need to do to keep Canadians safe and to ensure the flow of goods and necessary equipment to Canadians.
So you are not ruling out the possibility of closing that border, but what would be the triggers for that to happen? Well, as I say, at every step, we will not rule out anything that could help to keep Canadians safe. We will make our assessments step by step as to the best way of keeping everyone safe. We are moving forward today, and there will be other announcements in the coming days, and every single time we will be assessing how we can better protect Canadians and keep our country and our economy and our citizens safe, as well as ensuring the proper functioning of our healthcare system. Now, some people believe that the U.S. will become what Europe is now. Are you concerned about that? Well, as I said, we are not ruling out any measure at this point. Everything is on the table to protect Canadians, but we're going to do this step by step, as we have from the beginning. We'll take the necessary measures when they become necessary.
You've said that your decisions thus far have been dictated by science. What is the science behind leaving the U.S. border open but denying entry to other travelers?
We recognize that the level of integration of our two economies and the coordination that we've had over the past while puts the U.S. in a separate category from the rest of the world. But we will continue to coordinate with the U.S. We will continue to examine next steps and measures that must be taken. Today we are announcing that we are closing our borders to all foreign nationals from everywhere around the world. We will have more announcements to make in the coming days as this situation evolves.
You said also that citizens people returning to Canada must self-isolate for 14 days. Are you preparing any measures to ensure that they do that, or is this still voluntary?
If we put in measures for mandatory self-isolation, as many people have looked for, there would need to be enforcement measures around that, both by public health and by public safety. We know that at this point, the expectation that people self-isolate is something that we've asked of Canadians around the country, that we are expecting people to do. We know that Canadians want to keep themselves and their families safe, and we are confident that people will do what is necessary to keep themselves, their loved ones, and their neighborhoods safe.
Christopher Nardi, National Post. On Friday, Health Minister Patty Hajdu said, and I quote, "Canadians think we can stop this at the border, but what we see is a global pandemic, which means that border measures are highly ineffective and, in some cases, can create harm. We see that in countries that had the worst expressions had the tightest borders." What changed?
We have seen over time various countries take very stiff border measures that proved ineffective. In Canada, we based our decisions on public health recommendations that ensured that Canada's approach worked for many, many weeks in keeping a very slow spread of the virus in Canada through contact tracing and other measures. We've now come to the point where the best advice from public health officials is that additional border measures on top of the social distancing measures that we are encouraging domestically is the right combination to move forward now.
How we've seen throughout the weekend complaints that airports weren't able to keep up, they weren't advising travelers. What makes you think that suddenly closing the border and redirecting flights to four places, the bureaucracy will able to adapt and actually enforce these measures?
We've already seen shifts at the airports where every single traveler gets asked if they have symptoms, gets asked to acknowledge that they've been asked to self-isolate. We will be putting forward more support in those four airports as well. I want to highlight that local jurisdictions are also stepping up to assist in those four airports. We know that there is much more that we can do, and that's what we are doing.
Guillaume Saint-Pierre, Journal de Montréal. Il y a un haut fonctionnaire de l'OMS qui a dit...
There is a senior WHO official who said the problem in society is that people are afraid of making a mistake and the consequences that could have for them. Does that apply to you? No, on the contrary, at every single step we have taken the necessary measures recommended by the best possible experts to keep Canadians safe. And that's one of the reasons why, from the very beginning of this virus crisis, we have seen measures working in Canada. We are on a trajectory that is much lower than in other Western countries. So we are also taking additional measures today because it is time to do that. We had a cabinet meeting yesterday where we had a lengthy discussion about various recommendations, and we're confident that what we're recommending today or doing today is necessary to help Canadians stay safe. Of course, the situation is evolving all the time, and we will be updating these measures as new ones are required. You say you're relying on the recommendations of experts, but they don't all agree necessarily. So, does there come a time when a political decision is necessary to reassure citizens? Well, decisions are not being made by experts. They're being made by people who are elected to serve Canadians. And those decisions are made at the result after discussions with experts. And we have a responsibility as a government to make those decisions, and that's exactly what we're doing. Thank you very much.
And that's the Prime Minister of Canada speaking.
All right, so that was the word from the Prime Minister, Justin Trudeau, making announcements about how, after being advised by experts, how the government is going to deal with the borders versus the COVID-19 virus, and hopefully to curb future infections. So one of the issues, of course, is that the infection rate is still rising. As I said earlier in the broadcast, that for Canada, we're at 324 total cases. And there's another 17 probable cases. Probable meaning that they're waiting for lab testing to come around. Right now, British Columbia is at 73. Alberta is at 56. It would seem that Alberta really has had a steep rise in number of cases. Saskatchewan, it has 1. Manitoba has 1. Ontario has 145. Quebec 39. New Brunswick has one case. PEI has one case. And so there's our totals as the number of cases rise of COVID-19. I do want to comment on, of course, the comment that Justin Trudeau made about staying connected to each other. Just because we can't have face-to-face meetings doesn't mean that we shouldn't break the connection. He has a good point with that, and he's right. Send the email, FaceTime, whatever it takes to actually connect with people around, and we need to work together and help each other through this time. I want to thank everybody for listening, and we will talk to you later on, possibly tomorrow with an update, of course, because at noontime there should be another update from the government about how they're handling COVID-19. So we want to thank you for listening today, and we will talk to everybody again later on. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.